Hi dear friends, a very good morning to all of you. This is pharmacist Devansh talking to you in this video about a very dangerous and very common disease called anemia. Now what is anemia? Anemia is a blood disorder. Anemia is a blood disorder and there are a lot of risk factors or there are a lot of causing factors which causes anemia. Depending upon the cause, the anemia has several types. It can be aplastic anemia, it can be iron deficiency anemia, it can be sickle cell anemia, it can be thalassemia anemia, or it can be a vitamin deficiency anemia. Now, what is anemia? Anemia is a blood disorder in which the RBCs or the red blood cells do not have enough hemoglobin, or the protein, that is hemoglobin, do not have enough oxygen to supply to the body. Now hemoglobin and the RBC exchange oxygen and carbon dioxide in the lungs, and if they do not provide enough oxygen to the whole part of the body, there are a lot of changes and there are a lot of symptoms associated with it. The number one is tiredness, weakness, feeling of faintness, muscle pain, chest pain, and etc. It can also be due to the immune system being killing the RBCs, like in cases of leukemia, where the cancer affects the bone marrow, which is the site of development of RBC, that is red blood cells, and hemoglobin. Now, aplastic anemia is an anemia in which the body does not produce enough RBCs, which is required for the normal functioning of the body. It can be a genetic factor or it can be due to environmental factors. Now, talking about the iron deficiency anemia, the body does not have enough iron and the bone marrow is lacking enough iron to produce red blood cells and hemoglobin, so it causes iron deficiency anemia. Now the sickle cell anemia, as you can see that this is a normal RBC which has normal hemoglobin and normal protein and oxygen. Now in the sickle cell anemia, the RBC are of sickle cells and there is not enough space for oxygen to carry oxygen outside the or to the other parts of the body. The other is thalassemia. Now thalassemia is a blood disorder in which you require blood transfusion as the only treatment strategy because of the deficiency of hemoglobin or RBC in the body. The last type of anemia is vitamin deficiency anemia, the most common anemia present in the whole population of the whole world. Now, how the vitamin deficiency anemia is occurred or caused? As you all know that vitamin B12 folate is very important ingredient or the nutrient or the micronutrient required by the body to produce RBCs and hemoglobin. When there is not enough vitamin B12 present in the body, there is a deficiency of production of RBCs in the body and it results into vitamin deficiency anemia. Anemia is present all across the globe and it is a leading cause of concern for the healthcare authorities all across the world, and even the World Health Organization and the WHO has taken given strict guidelines to control the risk factor for the causing of anemia in the people of the whole world. Around 24 million people are affected by anemia all across the world globally per year basis, and it has been reported that around 1,83,000 deaths have occurred due to the anemia itself. It is the leading cause of morbidity. Morbidity means that you will live a very compromised life due to the presence of this disease known as anemia. And also, anemia is also one of the common factors or the common cause of increasing morbidity as well as mortality in the people all across the world. The treatment strategies for anemia includes iron supplements to deal with iron deficiency anemia and vitamin supplements to deal with vitamin deficiency anemia. The sickle cell anemia is inherited from the ancestors, so it requires blood transfusion and it requires blood exchange with the healthy RBCs. Thalassemia also requires blood exchange and exchange with the healthy RBCs and the hemoglobin in the body, and the patient suffers from throughout his life. Anemia is of two types, and one is the short duration anemia and the other is chronic, that is long duration anemia. The acute anemia can be treated with drugs and iron and vitamin supplements and multivitamin supplements. However, the chronic disease cannot be cured and it can only be managed in the patient's body with the help of supplements and through medical procedures. That's it in this video regarding the anemia. If you do like my videos and if you do like my talk, please like, share and subscribe to my channel. And if you would like to give feedback to me, please comment below in my video and I will get back to you. This is Devansh Mehta, MPharm MBA, MPharm in Pharmacology, signing off from Meerut, Uttar Pradesh, India. And Jai Hind.